House Bill 76 moved swiftly through committee and then the House floor last week, passing with bipartisan support. The bill would expand Medicaid under the Affordable Care Act to over 600,000 low-income North Carolinians. The state is currently one of 11 that still haven't adopted Medicaid expansion. The bill has been more than a decade in the making. Nicole Dozier, the director of the Health Advocacy Project, says that the stories of people affected by lack of access to affordable health care gave the bill the final push it needed to pass.
I think it's important that over all this time that the media has not let it die, that people in the community have not let it die, they've not given up hope.
Under current rules, many North Carolinians make too much money to qualify for Medicaid, yet too little for federal health care subsidies. Adults without children, for example, also fall outside of the qualifications for Medicaid, leaving more than 600,000 North Carolinians in a coverage gap and without health insurance. That would no longer be the case if the bill becomes law by changing Medicaid eligibility. Under the new system, any adult under 65 who makes less than 138% of the federal poverty level would qualify for Medicaid. Abby Emanuelson, the director at Care for Carolina, says that the right time for expansion is now.
I think now is really the time that it's good health policy and good fiscal policy for our state to expand.
Under Medicaid expansion, the federal government would go from paying around 74% of Medicaid costs in North Carolina to 90%. The state would only have to pay the remaining 10%. With the state, hospitals and insurance companies have agreed to pay the remaining 10%. Representative John Hardister, who was originally against expansion, says that federal funding was a convincing factor for passing it.
We're all sending money to the federal government every day of our lives. We're paying taxes. If we can get some of that money back for health care, to improve our health care system, I believe that's the right thing to do.
While there's bipartisan support for expansion, it's unclear if the Senate will pass their own bill or consider the one passed by the House, which hasn't been scheduled for committee hearings in the Senate yet. In Raleigh, I'm Walter Reinke, Carolina Week.